Hi there, folks. This is Dr. Ellenburg. Welcome to our medical show here on Fox News Talk 1020 AM. Also find us at FM 95.5, and you can find us online at foxnewskon.com. If you got questions about your health, today is the time to call right now between 2 and 3. Our number here is 522-1020. That's 522-1020. During the week, you'll find me at the Ellenburg Center for Natural Medicine. Our phone number there is 563-2366. Our website address is drellenburg.com, and that's drellenburg.com, drellenburg.com. Check us out, list of our services. Websites you might want to find some links to learn more about what out in the world affects your health, and even some recommended reading materials for you to check out as well. Again, it's drellenburg.com. I do see patients in the Kenai and Palmer areas, typically monthly. Give our office a call at 563-2366 for times and dates. All righty. Well, spring is slowly getting here. So I hope to encourage all you folks, many of you who decide that in the winter, exercising outside is not even a possibility. Well, now is the time to lose that excuse and get out there and walk or hike or bike or whatever it is you can do. Get outside. Put your extra coat on and a hat in your head 'cause it's not very warm out, but at least you can get outside and walk around without slipping and falling on the ground. So get outside, get some exercise going. Remember, it's good for everything about your health. Brought to you by exercise. Just kidding. So today's show, what we're talking about, we're going to go over vitamin D and a study on bone mineral density. Very interesting. We're talking about allergies in children. An article also talking about the use of naturopathic medicine in the treatment of cardiovascular disease. Very interesting article. We'll be discussing allergies today in the sense of it's that time of the year. Pollen allergies are rampant for many folks. They're slowly coming out. We'll probably have a big boom here at one time because of how cold it's been out. But it can be a big problem for a lot of people, and those things you can do for that. We'll discuss a couple of articles on cancer today as well. Inflammation included in a big piece of that. And I'll talk about some nasty side effects from people from the drug called zolpidem, otherwise known as Ambien, and some alternatives to using that drug for sleep that can be very, very helpful. All right, and if we get time, we will talk today about thyroid disease, one of my favorite topics. All right, again, if you've got questions about your health, the number to call is 522-1020. That's 522-1020. You can also live stream us online for your internet connection and hear maybe possibly a better connection at foxnewskon.com. Okay, well, where we go? Well, good old vitamin D. Here we are. It's that time of the year we actually get vitamin D from the sun. A little primer and a reminder for those who don't hear this show often or haven't heard it before. But with vitamin D, it's one of the things that most of the year in Alaska, we don't get much of it at all. And not because the sun's not out, it's because we actually, our ozone layer over our part of the planet that we live in, absorbs most of the ultraviolet B, UVB rays from the sun. And UVB is what stimulates or begins the production of vitamin D in our skin. So typically about right now, basically till about the middle of September, if you actually had the sun outside and you were to expose your body to it, you might actually get some vitamin D from the sun. Most of the year you do not, and that's why most Alaskans, if not all Alaskans, should probably be taking vitamin D. Various amounts, of course, depends on where you're at, and of course getting a blood test is never a bad idea. 25-hydroxyvitamin D. 25-hydroxyvitamin D is the blood test you want to get. Look at your vitamin D levels. So one big area that vitamin D has been involved in for a long time when I talk about patients who have osteoporosis or have what's called osteopenia, that means it's not as bad enough yet to be titled osteoporosis, is bone loss. And how do we prevent that? And, of course, we all sit here and think, well, you take calcium. That's what you need to take. Well, that's one part where things aren't particularly right because your bones are made up of 8 other minerals besides calcium. So taking high-dose calcium is a recommendation that I gave up here a couple of years ago and recommend patients taking trace minerals for their bones and also taking vitamin D. Now, the question comes to with vitamin D, what's the optimal dose? And that's been a tough one. And from our friends at the Vitamin D Council website, that's vitamindcouncil.com. That site was started by Dr. John Cannell. Has articles that you can belong to a newsletter. It's free. And there is membership required for certain parts of the website. But overall, lots of free information on vitamin D. It's vitamindcouncil.com. Is how much should we be taking? Or is there a dose that is dependent, meaning at a certain amount I take of vitamin D, will I get the bone help I actually want? And so a couple of past clinical trials have looked at using doses of vitamin D as low as 400 international units. And remember, the RDA, the recommended daily allowance for vitamin D, is 400 international units. That is not for optimal health. That's not even for baseline health. That's so you don't get rickets, disease associated with low vitamin D or a deficiency of vitamin D specifically. And a analysis that was done here not long ago looked at vitamin D supplementation in those taking about 800 international units a day of vitamin D, and noticed that it did help decrease the time needed to help fractures. That means bone breakage faster. And anybody out there who's got a broken bone or has known people with broken bones, you can speed it up by taking vitamin D and also taking vitamin C. I had the unfortunate event in my life of breaking many bones over a several span of time in my life, unfortunately. And it was not because I was deficient in something. It was some unfortunate accidents. But the reality is, even taking high-dose vitamin C, and what's high dose? 2,000 to 3,000 milligrams a day of vitamin C during that time period definitely decreased my fracture healing time, and my doctors at the time were quite amazed. Just chalked up to being in good health. Well, vitamin C is a precursor to collagen in the body, and collagen is things like connective tissue and skin and tendons and ligaments, and so therefore it can help speed those healing of those sort of things if they're injured. And now I know vitamin D can also help with your bones as well. So a new trial actually appeared in the Journal of Bone and Mineral Research, looking at healthy women aged 60 to 70 who were living in northeast Scotland, so in a place where they don't get a whole lot of vitamin D from the sun either. There were 263 of them in this study, and they were randomized to either take a placebo, that means nothing basically, 400 international units, or 1,000 international units of vitamin D daily. They did not administer any calcium whatsoever, but they did give them food questionnaires to see if they were getting enough intake from their food, which they said they were. And looked at the bone mineral density in these women at the beginning of the study and after a year of being in the study. And what they found was interesting. So when you do a DEXA scan or dual energy X-ray, that's what typically is looking at your bone density testing. And usually we look at the hip, possibly. We might also look at the lumbar spine and part of the femur at times, depending on what lab and how they're doing things. What radiology place and how they're doing things. But bone loss in the group in this study was actually much better in the 400 international unit and the 1,000 international unit group versus those not taking any vitamin D at all. Which is important. And essentially there was not a lot of change in the bone density at those doses, but it did not lose any. Otherwise, people tend to lose something. What else did we see? Well, bone mineral density in the lumbar spine was not very different in the treatment groups, which is good. So again, those who weren't treated had some bone loss, and those who did not, there was not a big difference. In testing the vitamin D levels, and these people had some really low levels of vitamin D. If you ever get a vitamin D test done, again, that's 25 hydroxy vitamin D, the reference range, that means what's the range for vitamin D supposed to be. So in this case, 30 to 100 is a typical range. Both groups, their average numbers in the beginning of the study were around 13, so they were very deficient in vitamin D. And the two groups, again, one was taking 400 international units a day, one was taking 1,000 international units of vitamin D a day, and they raised their levels up to 26 for 400 group and up to about 30 for the 1,000, so just in range for the 1,000 IU group. 1,000 IUs of vitamin D daily. And what they're trying to figure out is where at the point is there's a dose that's going to make changes for your bone health. And the reality is it's probably somewhere near 1,000 for most people. And that's not saying that's the only level, that's the only amount they should be taking. They might need to be taking actually a lot more. We've had patients we tested their vitamin D and it's so low they're taking 5,000 international units of vitamin D a day. Again, you want to get a blood test if you're taking doses like that. You may not need that much. You might need even more. It happens quite frequently. People actually need more than that. And again, if you're taking high amounts of vitamin D3, you should be tested yearly at least to make sure you're not getting a toxic range. It can be hard to do, but it's possible to do it, and I've seen it, so it can happen. But definitely for bone density, consider taking vitamin D. And again, I mentioned another thing too, trace minerals. They contain trace amounts of a variety of minerals that are good for your bones versus just taking one thing such as calcium. Okay, we turn today to Dr. Michael Ellenburg. This is our medical show here News Talk 1020 AM. You also find us FM at 95.5, and you'll find us online. You can live stream us at foxnewskoan.com. If you have questions about your health, give me a call here today. Here's a place to get some free advice about your health. Our number is 522-1020. It's 522-1020. Move on here. Allergies. Well, one of the more difficult things these days, and even in my short time in medicine, being licensed here, licensed as a practitioner for this a little over 10 years now, is allergies and asthma seem to be happening a lot more in children than did in the past. And we don't really have a great answer as to the why. There are certainly some possibilities. One of those suggested was called a hygiene hypothesis, suggesting that we're too clean of a society in a sense, and that we're not being exposed to enough things as we're children, and therefore our immune system is not as vigorous or is not as strong as it could be, and they're more reactive. Other one's been considered diet, and I would certainly say that's probably part of it. I'm not sure I agree with the hygiene hypothesis, but it might have something to do with it as well. And on top of all this, which is the study I'm about to discuss doesn't discuss this at all, is toxicity. There's a great site online that I've recommended for many years people to visit to learn more about how the environment, and that means anywhere you're alive in. That doesn't mean just outside. What goes in, and you might be exposed to. It means where you work, where you eat, where you sleep, where you breathe, basically your environment. But the website is the Environmental Working Group, or EWG.org, and a great site to read about a variety of things out there, especially in your food that can affect your health, even things in your water that can affect your health. And it's rigorous information. It's not some somebody just kind of pulling it down and pasting it up. They're actually doing research in a variety of areas. And one area they looked into a while back was looking at what are the amount of chemicals that are found in people. And one interesting fact from that work they did, so again, in the Environmental Working Group, is that they found like an average of 114 chemicals in umbilical cord blood of newborn babies. So children coming into the world with all these different chemicals already on board, from mom, or she's been exposed to in her time, can go into the child, right? So, in discussing why we have more allergies today, why is there more asthma, we certainly have to consider, and I know it's not been shown by fact, that toxicity, things we're exposed to from our environment, our food, our water, can definitely have an impact on us developing allergies, or in this case, asthma. A big area definitely tends to be your gastrointestinal tract, where we have all those billions, actually trillions, of bacteria in our GI tract. And it's these bacteria that are involved in major work in our immune system. I mean, 80%, 90% of your immune system lies within your gastrointestinal tract. So, one thing for treating allergies is considering, even in children and even in adults, is taking probiotics or consuming foods that have probiotics in them. And, yogurt can be one of those, but it doesn't tend to have a whole lot. Fermented foods, things like hummus, for example, or kimchi, could be examples, too, of eating fermented foods that can help provide your gastrointestinal tract with some good probiotics. Well, that's part of that picture as well. But beyond that is what we're going to be exposed to. And so this article, getting back to that for a minute, we'll come back to the GI tract here, but this is all about the GI tract anyways, is this article appeared, where did it appear? Probably I'll find that out. Nonetheless, I was looking at U.S.-born children having more allergies and asthma than those who are not. And so basically the title was, kids and teens who are born abroad and then immigrate to the U.S. are about half as likely to actually come down with asthma or allergies than those children and adolescents who are born in the U.S. And in this study, they surveyed 80,000 children, in this case, the parents, where they live, where they come from, how long you've been here, what's your race, what parts of the world were you at. And they definitely found something that when they moved over to the U.S. over a period of time, and the longer they were here, the greater was the occurrence of allergies or asthma in these different groups, and including food allergies. So it's not just pollen allergies or cat allergies or dog allergies. It's food allergies. And that's a huge piece taking place right now in our own country. I mean, the discussion on gluten, for example. I heard somebody came in recently and said, my doctor said it was a fad. Well, it's not a fad, actually. I mean, a lot of people actually have a problem with gluten. And it probably has to do with the type of wheat that we grow in this country, and it's processed and put into so many foods. That's part of that. I've even heard stories of people going over to Europe and eating, different gluten products, and they're fine over there. They come back here and they have to get off of gluten again. So that's interesting. So definitely food allergies are involved in this. Again, we're talking about the gastrointestinal tracts. Why is it different than somewhere else? I really think the issue is toxicity, and probably our diet is the biggest thing. I mean, we know that, we mentioned last week, we talked about the fact that you can eat certain foods that can increase certain, basically, components in your GI tract that can affect cardiovascular disease. We know the same thing's true for diabetics. They can be eating foods that literally affect the bacteria or the environment within the gastrointestinal tract that plays a factor if that person will develop type 2 or even type 1 diabetes. We're trying to figure these things, at least find these things out. So we're getting a much more healthier respect for our gastrointestinal health and what's going on there. And what is unfortunate for here is that the study points out, here it is. So, and again, the study did appear in the Journal of the American Medical Association. Pediatrics is where this article did appear. But they come over here, and then within a short period of time, over a couple of years or less, they develop food allergies. And they have some numbers here. For example, it says 30% of foreign-born children who immigrated more than a decade earlier had any type of allergy according to the parents, versus those who've been here about 2 years. They had about 20% of them had allergies after being here for 2 years, which did not have. And so how do we change this? Well, one, is clearly trying to promote your body's means of detoxifying. And your bodies do it every single day. Your liver does it all the time. But you can enhance that. You can enhance it by food, in this case, diet. You can enhance it via exercise, getting children and adults, in this case, to sweat. Sweating is really important. If you don't sweat, you don't remove a fair amount of toxic chemicals from your fat in your body. Many things we're exposed to like to stay in a lipid, that means a fat environment, a lipid-soluble environment. And, to get those things out, you got to sweat that stuff out. There's not a pill for it. There's not a vitamin for it to get it out. Now, different things can certainly be helped by taking supplements or even different herbs for that matter. But to remove those things, exercise is a key part of it, and so is the food. We really need to look harder and harder at having our children, eat healthy food and a variety of food. Eating vegetables, eating fruits. And again, there's issues with that too, because we talk about, they got pesticides in those things. Well, you got to pick the right ones that are low in pesticides or bioorganic. And again, I mentioned today already the Environmental Working Group. On their site, you can actually download for free a listing of what are the top 12 vegetables and fruits that you should buy in organic, and then what are the top 12 that you can buy that are not organic because the amount of pesticides sprayed on them is small. So it's important to understand it. For example, on the pesticide group, apples. They're so good for us, but yet they're the most heavily laden pesticide fruit. You want to buy organic. I know it costs more, but you want to buy organic. It makes a lot of sense to be doing that. But, there's also, getting back to the dietary thing too, allergies, we definitely know that the probiotics make a big difference too in children, because a couple of studies even out of Britain over the last several years have given pregnant mothers who have a history of, say, asthma or allergies or even eczema, for example, and give them probiotics while they're pregnant, and then give the children probiotics after they're born for a year, and they see some major reductions in the occurrences of asthma or allergies in those children whose mothers took probiotics, and then the children themselves took probiotics for a period of time afterwards. So really good stuff. And it's this study here, again, demonstrating that more kids in the U.S. have allergies than those who were born elsewhere. I don't know why that is, but we're giving some possibilities to that. I'm sure the biggest part of that is probably dietary. It's got to be. All right, well, folks, tune in today. This is Dr. Michael Ellenburg. This is our medical show here on News Talk 1020 AM and also on FM 95.5. And you can find us online at foxnewskoan.com. Our phone number here is 522-1020. It's 522-1020. Questions about your health, give me a call. I'll be happy to talk to you about your health. before we go to the break here in a couple of minutes, this was a pretty short one, but it just caught my eye, and it was entitled "The Addition of Naturopathic Medicine Boosts Cardiovascular Risk Reduction." And this 10-year risk study looked at having patients see naturopathic providers, and that's who I am. I am a naturopathic doctor here in the state. And they people in this study basically saw naturopathic doctors about 6 or 7 times, I think, over a period of time. And basically, they're looking for the outcome measurements in these studies here, looking at, do we have less cardiovascular occurrences, in this case, MIs, strokes, high blood pressure, just to name a few things. And they did. They had a very positive study. And this study was published online at the Canadian College of Naturopathic Medicine's journal, or is it Canadian Medical Association journal, but was done at the Canadian College of Naturopathic Medicine in Toronto, Ontario. And one point they point out in the study that I think's worth mentioning, and we've got time here, a few minutes here to do that, is that they say if the naturopathic doctor was properly trained, and something for you to know out there as far as consumers, not so much in Alaska, but in states where we're not licensed. So we're licensed in 16 states in the U.S., and for example, we're not licensed in Texas, or if you have relatives in Alabama, for example, or Georgia for that matter, or Tennessee, just to name some place in the South. I got a lot of relatives in those areas, but we're not licensed in those states. So what that means is your relatives could be seeing someone calling themselves a naturopathic doctor, and they may have never, ever gone to a naturopathic medical school. They may have gotten their degree through the mail, literally, or through correspondence training. And myself and those who work in licensed states have attended accredited, 4-year naturopathic medical schools. And the main places for those, one of them is the Canadian College of Naturopathic Medicine in Toronto. We've got another school in British Columbia. I attended Bastyr University, which is in Seattle, Washington. The National College of Naturopathic Medicine is in Portland. And the Southwest College of Naturopathic Medicine is down in Phoenix area, in Tempe area. And we also have a school out in Bridgeport, Connecticut as well. So those are the 5 main ones. And so this it's nice to remind that, because the article reminds people of that, as long as they have properly been trained, and that means a 4-year naturopathic medical school program. All right, very clear. But again, this study has demonstrated that patients, and the group of people in the study was age 25 to 65, over a couple of different cities, all had improvements in body weight, their waist size, lipids, blood pressure, and even their fasting glucose levels. And of course, the doctors they saw in this study, naturopathic doctors obviously, were being told, to helping patients pick out a good dietary program of eating, a good lifestyle, exercise, of course, and a variety of supplements that included, fish oil or a coenzyme Q10 or a variety of other factors. But this combination approach, the integrative approach with cardiovascular disease, can be a major component. And we have many patients that we work with that already here in Alaska with. So, all right, it's time that our break is now time. We'll be back here in about 5 minutes. Hold on there, back in a few minutes.
If you got a problem, don't care what it is. If you need a hand, I can assure you this. I can help. I got 2 strong arms, I can help. It would sure do me good to do you good. Let me help.
birds singing in the dead of night. Take these broken wings and learn to fly all your life. You were only waiting for this moment to arise.
Hi there, folks. This is Dr. Ellenburg. Welcome back to our second part of our medical show here on News Talk 1020 AM. Also find us FM 95.5. If you got questions about your health today, number to call is 522-1020, 522-1020. And we have a caller on line 1. Edith, are you there?
Yes, I am.
Hi there.
I wanted to know how to figure out how much protein a person should have in a protein smoothie.
Protein smoothie. Good question. A couple of ways. So, one, you need to have somebody actually calculate basically, and we could do it here, in a second, your lean body mass, which can be done actually through a variety of things online. Let me just pull this up real quick while I got you here. So, Edith, if you don't mind, can we get your weight and height?
5'5", probably. I've shrunk quite a bit.
5'5", okay.
Uh-huh.
And then how much do you weigh?
160.
160, okay. And anybody at home can do this. If you have a computer, you just basically put in lean body mass estimate or calculator, and you'll find several sites online that can do this. And this is helpful, so we put that in. And what we get is you got a lean mass of basically 97 pounds. And then from there, what somebody has to do is basically convert it into kilograms. So we got to do in kilograms. All you do is take your regular pounds and you divide it by 2.2, and that will give us kilograms. And then we're going to do one more thing with that. So let's do that. So we get basically 44 kilograms. Now, here's where the opinions vary, is that once you have this lean body mass calculated in kilograms, is what range for protein should you be doing? And some ranges that some people use basically is 1 gram per kilogram. So in that case, someone would be getting, like for you, Edith, maybe like 44 grams of protein a day. Or the one we're using too right now is a different figure, which we can do 0.8 times that, which is a little bit less, but somewhere between, say, 30 to 40 grams of protein. And when you're looking at a smoothie, a couple of things. So you're going to use protein powder in it, is that correct?
Yes.
Okay. You want to make sure that, first of all, a couple of things. One, I don't recommend people consume soy protein. It's not good for you.
No.
I would recommend either whey protein powder or hemp protein powder as well. And there's even some rice protein powders, and there's even some pea protein powders that could be consumed. But in this case, and you're having more than one meal a day too, right? You're not just having a smoothie, right?
Yes.
Okay. So, basically, if you're doing it in the morning, which is a good time to be doing this, you'd want to be probably having about 20 grams, of protein in that smoothie, and that would get things off to a great start for the whole day, for that matter. So, you'll need to know what the serving size is for the product that you actually have, and so that's important to have someone tell you if you have a hard time seeing things and looking at that, to tell you, this much is this much. And some companies it's 1 scoop or it's 1 tablespoon. It really depends on the product and how it's all put together. But that's what you'll be shooting for. And and give other examples besides a smoothie. A hard-boiled egg or a soft-boiled egg or is about 7 grams of protein. Just gives people some general ideas of some protein sources that are out there. Consume obviously meat and chicken. Obviously protein sources as well. That serving size of that typically somewhere probably between say 6 and 8 ounces will be somewhere around, say maybe 15 grams of protein, maybe a little high on that side of things. But just to give some general ideas of looking at what you're consuming and getting proper protein intake in a day. But I wouldn't recommend necessarily eating all your protein in one spot in the morning, like take 40 grams. I wouldn't do that all at once. Okay.
You would not?
I would not.
Okay.
No, I don't think that's necessary for you to do that. So.
And it isn't going to tell you the way you feel, whether you're getting enough protein?
Not necessarily.
Okay.
It really depends on someone's activity level. Again, your body mass, what you're up to. I mean, that'll be the difference. I mean, if someone's, really, really low in protein, they may be tired more often than not. It's possible. It can also affect the way your brain even thinks, because you need proteins to make neurotransmitters in your brain.
Yeah.
But consuming that type of protein over a period of time, I would suggest, if you did it every day, for example, that typical much, you should know something in a couple of weeks if that was going to make you feel differently.
But the smoothie, if you're going to do the smoothie, then you said do not do it all
Yeah, I wouldn't do 40 grams of protein for breakfast. I wouldn't do that. That's too much for you at once, in my opinion. So spread it out a bit, but half of it you could do in one sitting.
And you could split the smoothie to half it.
You could, yeah. If you want to do it twice a day, you could do that.
Yeah.
Yep.
Yeah.
You sure could.
Okay. Thank you very much.
Yeah. Thanks for the call.
Bye-bye.
Bye-bye. Yeah, there's a lot of debate out there, folks, with protein intake, and I remember the days of doing a fair amount of weightlifting, and there were people like doing 100 grams of protein a day, which is crazy. Eating too much protein really, long term, will age you. It ages your body long term. So, it's coming from a guy who used to think that eating protein was the best thing you could do for yourself, and so I've definitely changed my tune on that one to a large degree, and paying more attention to the amount of protein I actually get into myself on a regular basis versus taking too much of it. And also a person who uses smoothies. I don't do one every day like I used to, but I do take one daily. And, kind of, if people have questions there, is like, what kind of mix would you put there together? Well, I use hemp protein powder because I have a dairy allergy. And so in a shake, I have rice milk because I'm not consuming dairy. I put a whole banana in. I put a couple of tablespoons of organic blueberries, a tablespoon of almond butter. It goes in, blend it up, away you go. So that's pretty much my standard one. If you're using whey protein powder, that'd be fine too, as long as you don't have a dairy allergy or if you're lactose intolerant. If you're lactose intolerant, it means you have a dairy allergy and probably should not eat dairy often at all. Okay, sometimes people get kind of confused about, well, I'm lactose intolerant, so I drink lactose-free milk. No. You need to be off dairy completely and have it just once in a while instead of eating it, consuming this, because it's really hard on your gastrointestinal tract long term and can cause more problems for you than you want to have. That's a great thing. Again, online, you can just literally type in, lean body mass estimate calculator, and you'll put your numbers in, and you could probably do sheet right there. You have metric. So if you know what you weigh in kilograms and how tall you are in centimeters, you can do it that way too. All right, great. Let's give that call, Edith. Again, questions about your health. Number here is 522-1020, 522-1020. And we'll move forward here. Article that appeared very recently. You're talking about the use of probiotics to treat pollen allergies. And this article appeared in the European Journal of Clinical Nutrition. And there are different types of probiotics that are out there as far as the bacteria. And in this particular one, they use a strain of the Bifidobacterium lactis was the one they used. But there are different types. Many of us have heard of the word acidophilus. That's Lactobacillus acidophilus is one type of other probiotic strain that can be used in people as far as food is concerned, and also for supplementation. But in this one, they were looking at the use of that, and this research took place over in Europe, and they basically were looking at certain aspects of the immune system. We have things called cytokines, for example, cytokines in our immune system that are involved in inflammatory things that can make it happen. They can also affect if we have allergies or histamine release, and have symptoms such as the runny nose, itchy eyes, sore throat, sneezing. And in this study, they took 2 grams a day, and that'll come out to about 4 billion units of probiotics daily. And that's kind of important to mention that number. Not the fact that it's 4 billion, but the fact that it's in the billion numbers. And one thing that I've learned over the last couple of years, going to a couple of different gastroenterology conferences, is in talking about probiotics, is that many providers, including myself not too long ago, were not giving patients enough probiotics as far as a treatment or a supplement to try and treat a variety of gastrointestinal problems. And many companies didn't make it strong enough. And so you're basically getting minuscule amounts and not getting a whole lot of benefit in this case. But again, they were taking about 4 billion units of probiotics daily for 8 weeks. And specifically during pollen season for grass. And what they noticed was a major reduction in their overall symptoms during that time period. And again, you're giving bacteria to your GI tract, and it's like, well, how would that even help your allergies? Well, it does, because your GI tract regulates your immune system. It's extremely important to be taking care of that gastrointestinal tract. And taking, good probiotics, and maybe consuming foods that have natural probiotics already in them, such as yogurt, kimchi, sauerkraut, to name a couple of different examples. And a lot of yogurts naturally have good probiotics in there. I'm not into particularly in certain brands, but you don't get billions of units of probiotics typically in yogurt. You get some. So it's important to remember that. Say, well, I eat yogurt, so I'm fine. Well, you may not be getting enough if you need more And if you've been on antibiotics anytime recently or in the past, a lot of them, for example, your bacteria in your GI tract gets wiped out too at the same time, and so it's got to rebuild itself. And so a lot of patients who are taking antibiotics will take a probiotic supplement at a different time of the day away from the antibiotic to help decrease the chances of them having any side effects. The most common side effect from antibiotics is antibiotic-associated diarrhea. It happens to many patients, unfortunately, and you can avoid that. Hopefully you can avoid taking antibiotics altogether if you can. Sometimes you just need them because they work, and sometimes you need to use them. But it's picking the right times for that. But again, I wanted to highlight this article because they were treating allergies, seasonal allergies, with probiotics. So again, we're in that timeline of the year where you certainly want to consider, if you have allergies, taking probiotics through the allergy season. If it hasn't quite started full swing yet, start right now. And on top of that, if you're having days where you're having a bad time with allergies, you can actually use vitamin C as a treatment, where you can take, say, 1,000 milligrams of vitamin C, say every hour or two throughout the day, to help stabilize your histamine release in your body. And it actually works if taken that way, but it has to be taken throughout the day. You can't, and it's set to get that great benefit if you're having a lot of symptoms. So again, worth considering. Again, using probiotics to treat pollen allergies. Good stuff. All right. Well, we've got about 12 or 13 minutes left in today's show. If you've got questions, now's a great time to call. Our number again here is 522-1020, 522-1020. All right, we'll move forward from here, and if we get some calls here, we'll take a break and chat with those people. Inflammation. Inflammation is really something that we're getting better at, I think, in medicine, trying to pay more attention to it overall. We really should be probably screening just about every patient who walks in the door and does lab work for some other reasons. What is their inflammatory levels in their body? What is their body up to concerning inflammation? And we have some decent tests, blood tests, that can show us inflammatory markers. And why is it important? Because it's involved in cardiovascular disease. It's involved in diabetes. It's involved in cancer. It's involved in Alzheimer's. It's involved in gout. I mean, you could just name so many different types of medical conditions that inflammation plays a huge, if not a crucial role in being involved in, or in the process of how that condition unfolds for a patient. So looking at, changing the environment within ourselves, or, in this case, quelling inflammation is key, absolutely key, in many disease conditions. And an article that we're going to make some comments on was written by Dr. Lise Altschuler. She is a naturopath doctor and one of my teachers from Bastyr back in the good old days. She's been a great provider and great help to the profession as a whole. But her article is entitled "The Inflammatory Landscape of Cancer," Dr. Altschuler. And she's talking again about this internal environment in our bodies, this inflammatory environment. And in the guise of cancer, when you have a kind of a chronic inflammation, you have this kind of prolonged response in our body being exposed to the inflammation towards tissues. And these inflammation ends up releasing, as she puts out here, powerful chemical messenger molecules such as enzymes and prostaglandins and cytokines. But the main thing is understanding that inflammation stimulates the release of many different types of chemical molecules in our bodies that turn things on you don't want turned on. Okay? Now, one of these she mentioned specifically, because it's one of my favorites to talk about, is nuclear factor kappa B, or NF-kappa B, which is really most likely how a lot of the statin drugs that are used to lower cholesterol actually work and improve, or can improve cardiovascular. I'm not promoting those. I'm just saying that in the studies that have been done on statin drugs that demonstrate some type of help in some certain patient groups, it's because they're affecting inflammation. It's not because they're affecting cholesterol. That's a secondary factor of the whole process. You pick a victim in this case, or to pick somebody to pick on, in that case, cholesterol. And cholesterol itself is a great anti-inflammatory fat in your body. You need cholesterol. You can't live without cholesterol. But in cancer, getting back to inflammation here, inflammation is the enemy. It's going to help progress the tumor growth. It's going to increase tumor growth. It's going to help increase metastasis in the body of tumors going elsewhere. And the biggest way is how you're decreasing those sort of things. And, one of my favorite things that when we see cancer patients, we talk to them quite a bit about, is a wonderful herb. Common name is turmeric. Latin name is curcuma longa. But curcumin is from turmeric. So the same about turmeric as a whole. And yes, you can put turmeric in your food. But I came back from a cancer conference here a few months ago, and there was a phenomenal lecture by a PhD scientist talking about curcumin, in this case turmeric, and all these different things and how it's involved in the body, and putting up these slides, 100 different ways that turmeric is involved and can help fight cancer. I'm like, wow. And inflammation at the same time, and it's good for your liver. I mean, all these great things with turmeric. And, if you have cancer, definitely one herb you want to consider getting on is probably consider taking something like turmeric. Make a lot of sense. And I would encourage you to do some research of your own if you have a provider who says, well, you're probably taking those sort of things. Well, I can tell you turmeric would be one thing you probably want to take. I think someday we'll probably see that involved as, maybe not so much cancer directly, but that'd be nice if it was that way. But people, there'll be supplements they'll sell, and they'll have turmeric along with it because it's such a great herb for so many different things, right? Inflammation, again, being the key here, and how do we lower that? She makes some very simple points too, saying, sufficient sleep, adequate exercise, a plant-based diet. All these things can help, minimize inflammation. Taking care of your stress. That's a huge piece. And, stress in itself can affect our immune system, and it can increase inflammation. It's hard to believe that, yes, stress can actually literally affect your body in a very chemical way, and it can. It's been proven that it can. So you definitely want to consider that in your approach towards lowering inflammation in your body. Some lab tests you could do for looking at inflammation, such as C-reactive protein, or CRP. We also have a SED rate, this is called, or erythrocyte sedimentation rate, or ESR for short. But SED rates can also measure inflammation in your body. And even parts of a complete blood count, looking at certain white blood cells, such as monocytes, can be elevated, can also indicate inflammation in people. A lot of times, too, tests aren't needed. Your joints hurt, they're inflamed. Okay, I have inflammation. How can I work on that? And obviously, dietary approach is a big deal. And this is one area where I've seen the work with eating foods that create an alkaline environment in your body that you can measure via urinary pH testing have been very helpful in patients with chronic inflammatory problems. Is getting them on a diet that's anti-inflammation, a diet that's going to turn down that inflammatory knob for them a lot, and at the same time make them feel a lot better, and also very good for you other parts of your body. But most of those diets are good for more than this one thing, of course. But inflammation, again, being the key, and I'll just kind of leave it at that in this article, because it really just driving home again how crucial it is to maintain and keep low levels of inflammation in your body. Yes, at times inflammation actually is good for some healing processes, but overall, long-term chronic inflammation is not good for your body or your system. And just popping a drug for every time to lower inflammatory levels is not the answer either. You need to change the environment, change the milieu in your body. Okay, change why you're having an inflamed system. That's what you need to be changing. Okay, well, we got about 6 minutes left in today's show, roughly. If you got questions, now's a great time to call, because if you call too late, we got to rush through your question. We got our number here is 522-1020. It's 522-1020. Questions about your health, about topics, hey, it's free reign. It's on medicine. Anything you want, call in if you like. 522-1020. I wanted to go over today talking about a recent study that came out, Ambien. And this study kind of was a collaboration of from friends, and from groups. And it was a huge study called the Substance Abuse and Mental Health Services Administration, or SAMHSA, basically sponsored this study to look at the side effects of people who are taking Ambien. And what is known about Ambien is that women, and particularly the elderly, appear to be more prone to having an adverse reaction in relations to Ambien than those who are not. And Ambien, if you don't know, is prescribed for a short-term treatment of insomnia, but many people have taken this stuff long-term. And in this report, in 2010, there were over 64,000 emergency department visits that involved Ambien. And about a third of those visits were attributed to an adverse reaction. And these adverse reactions have, of course, increased, unfortunately, over the last this 5-year period of time from 2005 to 2010 because it's being used more and more in more patients, of course. And what we do know is that the effects, or the side effects in this case, seem to affect women more than men as an adverse reaction. And it may be because women tend to go to see doctors more than guys do most of the time. And that's the truth. I've been doing this 10, 11 years, practicing medicine. And, more times than not, you're going to see women coming in to see you than you are guys, because we'll tend to wait till the last minute or until, you know what, now it's really impacting my health. I'll go see somebody about it. And that's kind of how we are. So, but in this case, we're not, as far for the women versus men, it probably has to do with the fact of how women actually metabolize the drug versus men. And there's a difference in that, how that works with this particular drug. Remember, we don't know everything about how these things work in the body in the first place. We know a little bit about a lot, but not. And the question is what we don't know is really the question about medicine in general, which is huge and huge amounts of data that's still out there. Or this drug and one person does this, and this does this to somebody else. That even itself, we can't explain that sometimes what that is. But definitely, the Ambien is an issue. And what I want to kind of bring home was one is saying, there are different things that people could be taking for Ambien. But before we do that quickly, let's mention again some of the adverse side effects that were noted in the study are daytime drowsiness, dizziness, hallucinations, and behavioral changes, being agitated. And people actually sleepwalking. And I've discussed this on the show several years ago, even sleep driving the car, and they were on Ambien. They didn't remember it at all. So it's pretty wild. There are much more safer things to be taking for sleep than taking Ambien. And yes, for short-term insomnia, in some people, it makes some sense if they can't get anything else to work for them. But mentioning some things that are good for sleep, a very simple one is taking some calcium, magnesium. We're just taking magnesium by itself about a half hour before bed. It relaxes people. Magnesium is used in your body for over 300 different reactions in your body. Uses magnesium. And you can take it, about a half hour, maybe 20 minutes before you go to bed, and you'll probably sleep better. And it's good for anybody getting nighttime leg cramping. It's probably a sign that you most likely are deficient in magnesium, even possibly potassium, but probably definitely magnesium. You should be using it for that, and it can help. Melatonin can be used for sleep. The biggest thing is the dose somebody takes, and it's pretty safe stuff. But some folks need to take 5 or 10 milligrams of melatonin a night versus somebody else can take 1 milligram, and it works great for them. So you need to consider that. And again, melatonin can also be used in a spray. They're making that these days in actually a sublingual application where you spray it under your tongue. And it's wrapped, in this case, in a fatty substance to allow it to be absorbed a lot easier from under your tongue. So you've got melatonin, you've got magnesium. One of my favorite amino acids is that's not essential, means your body doesn't need to have it. Specifically, it's called glycine, Glycine. Glycine can be very helpful at helping people relax. I use it in a lot of patients for short-term treatment of anxiety problems because you're trying to figure out why they have anxiety, but it can help while we're trying to get it figured out. But even taking that before you sleep at night can help. Again, glycine is something to consider, along with, mentioned already, melatonin. We mentioned magnesium, there's glycine, different herbs that help people out. I know valerian root's been out forever. It's been great for sleep as well. So a lot of good things for sleep besides taking Ambien. So please consider those things. And this week we'll start off our show off talking about thyroid disease this week. So thanks for the calls today, and thanks for tuning in. During the week you'll find me at the Ellenburg Center for Natural Medicine. And our phone number there is 563-2366. Website address is drellenburg.com. Have a great week. Take care.
A folding table and a folding chair, a folded hand, a poker there. All new directions must go everywhere. Big round people in a cool little square. Or you can cut it with a boat or a plane. Man, it's gonna take a new train. You'll be leaving on a new